So today we will be talking about multifetal pregnancy. And in multifetal pregnancy, we will be focusing on twin pregnancy. So why are we taking multifetal pregnancy as a separate class? It is important because as compared to singleton pregnancies, the twin pregnancies are at increased risk of maternal and fetal complications, due to which there is often iatrogenic preterm birth. So the risk is significantly higher in monochorionic pregnancy as compared with the dichorionic pregnancies. So first, the twins are already at a higher risk, and in twins, the monochorionic ones are suffering a greater risk. So remember, all the twin pregnancies, they have a higher risk of preterm birth because the space is same, and now we have two or multiple babies in the same space. So there's a limit to the stretchability. And then we have maternal hypertensive disorders, diabetes, the gestational diabetes, and the PPROM, that is premature rupture of membranes, compared to a singleton gestation. But it is the chorionicity that is going to decide the prognosis of multiple gestation. So multiple gestation is at higher risk as compared to singleton gestation. And in multiple gestation, it's the chorionicity that is going to determine the further prognosis. Although the monochorionic twins account for about 20%, only 20% of the twin gestations, but they account for 30% of all the pregnancy related complications. So you know now why monochorionic twins are being studied as majority of the component of this lecture, because they are the ones which are going to cause this complications. Okay, so starting with very basics, twin pregnancy can be classified as monozygotic or dizygotic in nature. Dizygotic twinning occurs when two separate fertilizations happen. So this is dizygotic. And monozygotic twinning is when a single fertilization has happened and forms morula, and this divides into two or more embryos. So this is basic. So in dizygotic twinning, there are two separate events of fertilization, and they will result in two genetically unique embryos. Okay, so that's the basic difference. And in monozygotic twinning, you have a single fertilized morula that is going to divide into two parts, and hence the genetic concordance is there. The timing of the division of this morula is going to decide which type of twinning will happen in this monozygotic twinning. So dichorionic twins and monochorionic twins both can be seen in our monozygotic fusion. Okay, so dichorionic twins happen when the division is happening within 1 to 3 days post fertilization. So before implantation, if that cell while traveling has split into two components, it will form two complete cell lines. तो खुद का कोरियन बनाएगा तो डाइकोरियोनिक हो गया, खुद का एमनियन बनाएगा तो डायएमनियोटिक हो गया. ठीक है, एक बार रिपीट कर लेते हैं. सो ट्विन प्रेगनेंसीज कैन बी मोनोजाइगोटिक और डाइजाइगोटिक. Monozygotic occurs when a single fertilized morula is going to split to form two embryos. And dizygotic is the event where two separate fertilizations are happening. जब दो fertilizations हो रहे हैं तो they will form two chorions and two amnions, तो सारे डाइकोरियोनिक डायएमनियोटिक हैं. अब मोनोजाइगोटिक ट्विनिंग्स जो होती है, इन दैट डिपेंडिंग ऑन व्हेन द फर्टिलाइजेशन, व्हेन द डिवीजन हैज हैपेंड पोस्ट फर्टिलाइजेशन, it will decide which type of twinning will occur. So in monozygotic twinning, if this division is happening within 1 to 3 days post fertilization, it will form two complete cell lines. So two chorion and two amnion. So this will be dichorionic diamniotic twins. But if the division is going to happen after 4 days, so this division is happening after 4 days. By then the chorion has already formed. So all the babies now will be monochorionic if the division has happened after 4 days. Now, further classifying this is that if the division has happened within 4 to 8 days post fertilization, so they will have their separate amniotic sacs. So monochorionic, diamniotic. So first, the division has happened after 4 days. After 4 days, that means chorion has already formed. So chorion is going to remain the same for all these babies. If the division is happening in the earlier part, which is 4 to 8 days, they will have separate amniotic sacs. If the division is between 8 to 13 days post fertilization, they will have a single amniotic sac. So now they are monoamniotic. And if after 13 days the division happens, usually it is incomplete. So the babies are not completely separated, and that leads to conjoint twinning. It's very rare. So have you understood the timeline? So if the division is happening within 3 days, then we have dichorionic twins. If it is happening after 4 days, chorion has already formed and we have monochorionic twins. Monochorionic twins, if the division is between 4 to 8 days, it will have two separate amniotic sacs. After 8 days, single amniotic sac. After 13 days, the division is often incomplete and that leads to conjoint twinning. So summarizing our findings here. So if there is two separate fertilization, it leads to dizygotic pregnancy. And all the dizygotic pregnancies are dichorionic and diamniotic. Why? Because two cell lines are there. They will form their own chorion, so dichorionic, and they will have their own amniotic cavity in which they'll develop, so diamniotic. Right? But what is monozygotic pregnancy? And there is a single fertilization. So once there is a single fertilization, this morula is now going to split into two embryos to give rise to twins. So if the division is happening within 1 to 3 days, it will be same as dichorionic diamniotic because two cell lines, two chorion, two amniotic cavity. If the division is happening within 4 to 8 days, the chorion is same, but the amniotic cavity is now separate. So monochorionic, diamniotic. So if the split is happening after 8 to 13 days, then it's monochorionic, monoamniotic, and after 13 days, it's conjoint twinning. Just give me a minute. Okay. So is it clear till now? The basics are clear. If anyone has any doubt, you can let me know right now. So this is the summary, the entire table, which will help you clarify. Okay, now we'll move to the next chapter. Twin pregnancy you have diagnosed. Okay, how will you date it? Dating is the most important part, as I've repeatedly told you. If dating is correct, then only you can diagnose growth abnormalities. Okay, so for dating of twin pregnancy, best time to date is first trimester. So in first trimester, that is prior to 13 plus 6 week gestation, in a spontaneously conceived twin pregnancy, you date it in the first trimester ideally by CRL. So CRL is the ultimate thing that we use in the singleton pregnancy also. So CRL is the one which is going to give you the dating for this pregnancy, and you will use the CRL of the larger twin. Okay. And in cases of IVF, you have the most accurate dates from the lab. So you use the embryo age and the transfer date to calculate. So you'll get the exact dating. If if the patient is coming after first trimester, then head circumference has to be used, and the head circumference of the larger twin. So in the dating part, you are using the larger twins parameters to avoid missing on SGA of the other baby, right? So in the first trimester, CRL of larger baby, and after 14 weeks, head circumference of the larger twin.